Good afternoon. It's an honor for me to moderate this session. So let me just begin by introducing my esteemed panelists. I have with me on my left Mr. Tashi. He is with the National Policy Coordination Division of the Cabinet Secretariat. Tashi is a planning officer at OCASC, I guess that's the acronym for that, with over 14 years of experience in national development planning, public policy coordination, and cross-sectoral strategy formulation. So currently he serves in the National Policy Coordination Division, where he oversees the formulation, review, and harmonization of national policies, ensuring that policy frameworks are inclusive and aligned with GNH principles and long-term national priorities. In addition, he also serves as the focal officer for the development of the National Social Protection Strategy and the Sustainable Population Development Strategy. Before joining OCASC, Tashi served as planning officer for Samtsi and Samrujongkhar Dzongkhags, where he led the formulation and implementation of multiple five-year plans. He holds a Master's of Public Policy and Management from Murdoch University. So welcome to the panel. Our second panelist is Ms. Kunzang Chodin, who is a senior HR officer, human resource officer at the Royal Civil Service Commission of Bhutan, where she has served since 2014. With over a decade of experience, she has worked across HR, strategic planning, and policy reform, including serving as the Secretariat for Bhutan's Civil Service Transformation Exercise. She has played a key role in driving workforce strategies, HR policy improvements, and civil service reform initiatives, including leading the career progression reform in 2016 and supporting workforce and succession planning frameworks. Kunzang holds a master's in business from Queensland University of Technology, Australia, under the Australia Awards Scholarship. She's also received scholastic honors in a postgraduate diploma in public administration from the Royal Institute of Management and holds a bachelor's in commerce from Gedu College of Business Studies. She also served as chairperson of the Bhutan Australia Alumni Association, actively promoting professional networks and alumni engagement. Our third panelist is Ms. Dema Tham, who is a lecturer at Jimmy Singye Wangchuk Law School. Dema is a faculty member at JSW Law, where she teaches penal law and restorative justice. She's also the clinical supervisor of the Human Dignity Clinic, where the students and she work together with women, children, young people, elderly, and persons with disabilities. Before joining academia in 2015, Dema also worked for the National Assembly Secretariat. She was the recipient of the U.S. State Department Legislative Fellows Award and served as the Legislative Committee Secretary to two key parliamentary committees, the Legislative Committee and the Human Rights Committee. She holds a Master's of Law with a specialization in Criminal Justice and Criminology from the University of New South Wales, a postgraduate diploma in National Law from the Royal Institute of Management, and a BA LLB from Government Law College, Mumbai. She is also a licensed member of the bar and actively engages in pro bono legal aid, offering legal assistance to marginalized and vulnerable communities. Dema is the co-author of Principles of Criminal Law, a treatise on the Penal Code of Bhutan and criminal defenses under the Penal Code of Bhutan. And her current research examines the effectiveness of harsh punishments, access to justice in Bhutan, and the impact of climate change on persons with disabilities. And finally, we have Dr. Sanga Dorji, who is a physiotherapist at the Jigme Dorji Wangchuk National Referral Hospital. Dr. Dorji has 29 years of professional experience working with the Ministry of Health as a clinician and in administrative jobs. He has expertise in clinical management, policy development, and teaching. He is presently working as a physiotherapy and rehabilitation specialist at the National Referral Hospital. He's also the chairperson of the Board of Directors of the Disabled People's Organization of Bhutan. Before this position, he worked as head of the physiotherapy department in the same hospital while volunteering as an ED in the DPOB during his spare time. Dr. Dorji also has experience in curriculum development for physiotherapy, students and also took part in developing the national policy for persons with disabilities and senior citizens. He has an MSc in medical rehabilitation from McMaster University, Canada, and a BSc in physiotherapy from City University of London, UK. So, a round of applause to all my panelists. Thank you. The morning session has been very engaging. I think, because you all represent different sections of the disabled community, whether as parents, as members of it, or other advocates, and just somehow experts in working in this field. It's been very encouraging to also see a lot of interaction happening at the exhibition stalls outside, which I hope you all have the time to visit. So earlier, I think we talked about the stages from birth on towards education and early childhood and so forth. Now we move on, transition to the next phase in our lives, which is then in this case, I guess I'm given skilling, employment, and policies environment. So we have on the panel different members that have a lot of expertise in these specific different areas. So I will begin with a question each for each one of my panelists so that they can share their expertise and knowledge with all of us, and then we'll take questions after that. Yeah. So beginning with the World Civil Service Commission, I guess earlier we talked about sound education, and of course the bottleneck gets narrower and narrower because each stage in our lives, people are weeded out, right? And then only a few people go on beyond that stage. But in your experience with being at the Royal Civil Service Commission, what do you see are like important trends that we need to look out for in Bhutan? Some challenges that we see, and maybe other sorry. Excuse my mistake. So I was just reading my panelists wrong. So we'll begin with the Cabinet Secretary, which has the overall mandate to look at social protection from a much wider lens, because earlier we saw experience and wisdom coming from different segments of this community, but collectively as a country, I mean, we do have a Cabinet Secretary that has the mandate to look at the overall bigger picture. So in terms of, I think for the community here in Bhutan, we go back, everybody talks about the Constitution and says that the Constitution has provisions for it, of equality and respect and all that. But from a cabinet perspective, I think looking at the whole country in terms of coming up with strategies that feed into it, what are your thoughts that you can share, your experiences so far that you have come across in seeing how we can best bring everybody together under this one umbrella?
Good Zambo, and a very good afternoon to everyone. On behalf of the Office of Cabinet Affairs and Strategic Coordination, I would like to thank Bhutan Foundation and the POB for organizing this conference and also making us part of this discussion. So just to provide an overview of the work that the government is doing on the disability front, as you rightly mentioned, currently under the leadership of the Cabinet Secretary, we are currently developing the national strategy for social protection. So it is at an advanced stage, and we are hopeful to have it approved in the early 2026. I think just trying to pick up from the earlier panel discussion. So we have seen the gaps and challenges in terms of implementing interventions and programs related to persons with disabilities. And from the OCUS point of view, one of the main reasons why we came up with this strategy is actually to address these gaps. So we see sectors, agencies implementing interventions related to disabilities in their own fields, but then often we find that these interventions do not talk with each other. The policies and interventions implemented by the health ministry doesn't link with the interventions that are planned and implemented by Ministry of Education and Skills Development. So for that very reason, until now we don't have a unified document that actually brings all this together. And through this strategy, while we have been implementing disability-related interventions a long time, but this has been done in isolation and in silos as a piecemeal interventions. So through this strategy, we try to enhance the coordination and also in terms of maximizing the effectiveness and efficiency of the programs implemented.
Yes. Thank you. I think it's clear that the Cabinet Secretariat has a bigger role to play in bringing everybody together, like you rightly said. But I think also earlier in the session, in the earlier sessions, the speakers also talked about a registry or somehow bringing everybody together. We always say, actually, just a handful of people living in Bhutan. So it should be doable to having that initial assessment, having that registry, which will then lead on to making it easier for any kind of intervention all throughout their lives in Mona. So thank you for that. I'll just move on to my next panelist. Of course, in the course of our lives, just moving on from education, hopefully then mainstreaming, I think that's always a challenge for people with disabilities in really bringing them into the workforce and all that. And I know the civil service, of course, is the biggest employer for Bhutan, and you have made progress in being mindful of that. But if you can just maybe share some highlights. I remember conversing with you earlier also, you had some interesting incidents that you talked about. So if you can take it.
Yeah, thank you, Lassa. So I'd just say that working in HR, I've actually seen how policy, systems, and working environment, it shapes opportunities for persons with disabilities. And not just that, especially in RCAC, the number of civil servants categorized as persons with disabilities very insignificant. We only have about 31. As I was preparing for the panel discussion here, because we lack data on persons with disabilities, I had to manually call each of my HR colleagues and jot down the numbers. So there are approximately 31, but we are not sure whether our definition is wholesome. Not just that, wherever possible, RCC have been making concerted efforts to make our HR practices more simpler, more accessible, and more user-friendly to ensure that civil servants and candidates with disabilities can participate effectively. And just to share some things, because I'm in HR, I want to just focus on some of the interventions that RCC has brought about as in the HR field. In terms of recruitment, we know that especially for the civil service recruitment examination, there is no discrimination. The civil service upholds the principles of meritocracy and transparency in carrying out all of its HR function. And during recruitment, what we do is, in order to ensure that everybody gets to compete equally, and persons with recognizing the different needs of persons with disability, at the time of registration, we ask questions, we collect information on their mobility, their visual needs, their speech, and others, so that necessary arrangements are facilitated, so that every one of them can compete on an equal footing. And we've also had instances in the past few years. We've had people, persons with low visibility. So what we've done, we've made the question booklet, the font size bigger. The standard size is 12, but for them, we make 18 to 20. The font size has been enlarged for them. And in terms of the overall examination process, they get 20% additional time. And we've had people, persons with speech impairment. So what we've done, normally in the interview processes, it's the verbal command, but then for them, we facilitated even a written viva examination for them. And the persons with disabilities, the examination for them, the examination center is dedicated in Changangka Middle Secondary School, and we have dedicated invigilators in single assigned invigilation room. And initially, when the civil service examination started, all of these were new, and then we've started use of assistive technologies. Not just that, the preliminary examination, which evaluates a person's interpersonal, intellectual ability, aptitude testing, it was very difficult for someone who was visually impaired because mathematics, this is not something that they learn. So what we've done, we've simplified the questions for them, not changing the question, but if it is a pie chart, we formulate it in a tabular chart. So we've facilitated that. Until date, we've had persons with disabilities coming in the top 36. So annually, the administration services is considered the most competitive examination selection process. And we've had persons with disabilities come in top 10, and results will be announced day after. You will not be surprised, we have a number of them coming in the top 10. And till date, over the past 7 years, we've recruited 19 persons with disabilities so far in the civil service. Going on to the transfer rules, beyond recruitment, then I'll go to transfer promotions. So in terms of transfer, we say that transfers are also based on merit. So once you're posted in a, once you get your placement assigned, you are not eligible for transfer for another 3 years. But what we do, because we recognize the need for them, if they are required to be posted in a specific location, or if civil servants or their dependents require posting in a specific location, these are also being facilitated. And even in terms of performance management system, everybody calls it the infamous moderation exercise, right? So we have the forced ranking concept. So we've had, the commission has made exception where persons with disabilities have been exempted from the moderation pool, not because they're incompetent, because the commission recognizes that they will have to be assessed against their own capabilities and not with a larger pool. And then the commission, this has been done only on a case-by-case basis, and commission is looking at revamping and relooking at revising our performance evaluation manual. And sorry, I'll just look at my points quickly. So in terms of training and development, I'd say we provide equal opportunities for both in-country and ex-country trainings. And for ex-country, sometimes we have dedicated slots for SEN teachers or persons with disabilities. Not just that, but then one issue there I'd say is, even when training opportunities are provided equally, oftentimes the training providers are not able to facilitate. There are no adequate infrastructure, which is why persons with disabilities sometimes they lack, they miss out on these. But then I'd want to just share it here because as I was preparing for this, because I work in the human resource management section, which deals in promotion, transfers, recruitment, I have no idea on the performance management or the training aspect. So I was pushing people from all these sectors to give me points so that I can come here and then, defend all of the civil service. And when I was doing that, I think it stirred up conversation in the office. So the commission has actually taken 2 decisions. One is, for the civil service recruitment examination, they will be procuring infrastructures, and not just that, they have now, like I said earlier, for trainings, let's say for an HR, I have 2 colleagues who are visually impaired, and we have identified institutes that provide competency-based trainings for the HRs, for the core competencies, but they never get to evaluate. Why? Because the training facilities lacks the infrastructure. Now, Commission's already informed the focal in that training division to identify specific trainings for HR where 2 of our colleagues can go. So I think this is what I wanted to share. Thank you.
Yes, thank you. Thank you. It looks like a conversation is already starting. Same thing, I mean, as we were preparing to come here, I was looking for this one building in Thimphu to take a photograph of a ramp that I saw for many years, and it was the steepest ramp. I couldn't imagine how a wheelchair would go up that ramp, but luckily I couldn't find that ramp. They've cut it off, so which is good. At least they noticed the mistake. I think people are becoming slightly more aware, but I think there are, the legal instruments are quite important because all of this needs some kind of a backing from a legal perspective as well. Like I said earlier, we always like to say, oh, our constitution says we were all protected. Our constitution says we have to maintain 60% forest cover at all times. But what happens if you breach that? What happens, or what are the guardrails, right? So I think that's where a lot of the policies, the acts, everything else that come. So from where you are, from the JSW Law School perspective, the research that you've done, what are some thoughts that you can share on the larger legal perspectives that affect people with disabilities in Bhutan.
Plus, thank you, Osong. First of all, I would like to also join my panel members in thanking DPOB Bhutan Foundation for having us here for this important discussion. And I would also like to extend my heartfelt congratulations to DPOB for the launch of Project Dranyam. I feel this initiative is a reflection of how progressive Bhutan is becoming in terms of recognizing and empowering persons with disabilities. And just this morning when I was reflecting and watching everything that was happening, I was also thinking to myself that it provides visibility, dignity, empowerment, and also, most importantly, I think meaningful opportunities for people whose talents have long deserved a wider platform. So thank you and congratulations. Coming to your question, I think from the JSW School of Law's perspective, because we are a legal institution, we only focus on access to justice for persons with disabilities. Because what we believe at the law school is that without inclusivity, I think people will not be able to access justice fairly. And for us to sort of enhance access to justice for persons with disabilities, our faculty, we have done a number of research that pertains to persons with disabilities, myself included. Like, for example, I have done a comprehensive qualitative research on impact of climate change on persons with disability. We've also done a study on violence against persons with disability, which is an ongoing study that we're undertaking. But most importantly, through the clinics, we've been meeting and we've also been interacting with persons with disabilities since 2022. And there we have found that while Bhutan has made progressive, significant progress with the enactment of 2019 National Policy on Persons with Disability, although not a law, it articulates commitments across education, health, livelihood, social protection, and all of that. And likewise, there are many other guidelines and regulations that are in place. And also, most importantly, and the most notable one is the ratification of UNCRPD in 2024. And I think the ratification of the UNCRPD itself marks the profound and transformative moment for Bhutan in terms of disability rights. I think, as we all know, it clearly outlines the obligations that the state has to adhere and ensure in terms of accessibility, social protection, reasonable accommodation, all of that. And what I've also noticed is that the ratification of UNCRPD also has, in a way, shifted the disability inclusion from being seen as a welfare commitment to being more now a legally binding commitment. And what that means is that now our existing laws, policies, and institutional practices will now be converted or will have to be aligned with the standards of the convention. The gap, or what I have seen or noticed in my research and in my interaction with persons with disability in the last 5 years, is that while we have these policies and practices in place, the gap is critical, it's challenging. We don't have a comprehensive disability law, which I feel is very, very important. Without a comprehensive disability law in place, all the provisions and the protections that are policies will only remain aspirational. It will not be enforceable. So I feel that having a disability law in place will transform the disability inclusion from a policy aspiration to that of a rights-based obligation, ensuring consistency, coordination, as Sateshi was earlier mentioning, as one of the problems, and also accountability. And also in my interaction with persons with disabilities, some of the problems, issues that I've seen is the lack of coordination amongst the stakeholders. I think that is also very crucial and vital for the I know now that the cabinet is looking after to bring together the stakeholders to have that common understanding of how the issues revolving around persons with disabilities should be looked at. And also, I think persons with disabilities still face a lot of problems in accessing justice, especially when they are navigating the police procedure, court procedure, and administrative system. And one of the most crucial or the important point that we need to note here is not having or bringing persons with disability on the table to discuss issues that revolve around them. I think it is very important and is also enshrined under one of the provisions of UNCRPD, where it highlights the importance of having or bringing the persons with disability in the decision-making processes and systems that affect their lives. So I guess this is also something that we need to really consider. Just yesterday, we received a letter from Cabinet inviting us to counseling for a 5-day workshop. I think Sir is organizing that workshop. Unfortunately, I cannot be there for that workshop, but I was looking at the list of people that were invited, exhaustive list, but I hope persons with disabilities are also included in that conversation during that workshop. So these are just a few, Anila, the gaps that I have sort of seen from my research and interaction with persons with disability from the legal perspective.
Yes. Thank you, La. It's quite encouraging to see a lot of representation from the private sector as well. I mean, I think a lot of the private ECCDs themselves wanting to be part of that and wanting to include this. For a lot of our infrastructure, there is no legal requirement right now. So we know that schools and even schools and hospitals are not necessarily always accessible. There's a lot of room for improvement. But I think the more conversation we have, the earlier we can get some of these incorporated, right? For example, one of our projects is the Wangdechuning Palace Museum and Cultural Center in Bhutan. So we were thinking about using some form of accessibility there. So one idea, of course, was to put in an elevator so the visitors can go up to the first floor, second floor at least. But then a wheelchair ramp was added to this historic monument, so we were allowed to do that, but it was done quite nicely. However, our traditional buildings and the way things are, it's still a challenge, because even if you take visitors up to the first floor, you cannot go from gallery to gallery because we have the gente, the threshold that has to keep the ghosts out, and traditionally, we have these. So it's a challenge to look through all of this, but I think there's a conversation that's happening. Just recently, we renovated an old basketball court in Thimphu. I think one of you were there as well at the inauguration or reopening. A wheelchair ramp was nicely put in place so that people on wheelchairs can also access these. So I think it's just an increasing conversation that we have. The more we talk about it, the more people become aware. The more we can do on all our parts. The Honorable Minister earlier said that this is a shared responsibility for all of us, not just the government, not just the NGOs, not just the private sector, but everybody together, right? So let me then move on to my next panelist, Dr. Sangha. Of course, you are a long-time product from Minsaling, which is like the age-old first institution that specialized for visually impaired. But not only that, you've gone on to continue to have an impressive career in a field that is quite much needed for Bhutan and respectable. But in all of these decades of your being a part of the community, but at the same time understanding that community from your insider's perspective, maybe some highlights that you could share with this gathering that consists of all of these different stakeholders. I think we would really like to listen to something that you can share about challenges or opportunities that you see for the future for Bhutan's, this community.
Yes. Thank you, La. And I will start by wishing Happy International Day for Persons with Disability. So I find it a little bit confusing to share my views, because on one hand, I'm a clinician, so service provider. On the other hand, I also involved very actively and right from the beginning, policy development, the UNCRP ratification, and all the lot of things. So I see difficulty on both sides, and I, as a person with disability, I know the challenges from the perspective of disability. But whatever I have said and done, the things shared by my earlier panelists, I have escaped many of them. Because when I first joined in 1995 in the civil service, I did not need to sit for the civil service exam because I was professional category. So I didn't have to face that. Later on, a lot of my friends had faced a lot of challenges. So, but we, those of us who were already in the field, we provided feedback, we supported, and I think have really come quite far. And after the policy endorsement and ratification, I think even the media has been quite active. Now every month at least, if not every day, every week you see few news about disability issues, so which creates awareness. But I think what many people don't see is that not from the all-round, broader perspective. For example, when they say disability, generally people think of someone in a wheelchair. In Bhutan's context, I think that's a good view, because our biggest challenge is environment. So therefore, if someone on the wheelchair can access, I think those who have with visual impairment or hearing impairment or even intellectual impairment, if you don't have physical impairment, we can access. And therefore, I think when we think of whether education, whether employment or anything, we have to think from all around, I think. For wheelchair, physical accessibility; for visual impairment, of course, something to guide or safety. For the hearing impairment, you have to think of communication. And then for intellectual, I think some sort of a repeated or additional support. So if you don't think from all around, just saying person with disability, I think people always think, if you see someone with visual impairment, they think immediately challenges and solution for person with visual impairment. And if you see a deaf person, then they think the problem for disability is purely communication. But on the other hand, the biggest challenge in Bhutan as well as in other developing countries, mountainous countries, is for wheelchair users. So therefore, if you don't take it all holistically, I think it's a big challenge, because otherwise talking about disability is as good as saying whole population of Bhutan. If you are old, 85 years and plus, or even 75 years and plus, you are multi-disabled. So therefore, when you plan or think of something, I think you should always think of your future. When you become 85, you yourself will become multi-disabled. So only then you will take it empathetically, not sympathetically. So that's one thing. Other thing, what we, in the earlier panel, what I was analyzing was that when you talked about private, so whether it's health, education or anything, in private you are thinking of income. So therefore, when we see well-known fact that disability and poverty are cause and consequence of each other, so that I think why we did not have many children in ECCD or private schools is that parents of person with disability, children with disability, could not afford. So therefore, we have to, if private entrepreneurs and private schools want to enroll or encourage person with disability, maybe you have to think from the economic perspective. So if you don't think that way, just making accessible, I think accessibility might be one thing, but on the other hand, economic factor is a big component. And at the same time, I think one of the private, or I don't know, whoever has asked, what's the solution or the theme? So in policy as well as in the convention, there are few words. One is called reasonable accommodation, which means you adapt and adjust according to the situation and need. The other one is universal design, which basically means not for the disabled child or person with disability, but everybody, so that it becomes a real inclusive. And the third one is twin track approach, where we may have policy, but if you don't know that users are not aware, users cannot demand. And even if users demand, if it's not accessible, then the facility cannot be used. So therefore, I think everything has to go hand in hand. So I wouldn't give any challenge or solution specifically, but I'll try to make it a little bit more confusing.
Las, thank you very much for that pearl of wisdom. From no, I think this has been very enlightening. I think one thing that I have realized is I'm also part of this community, right? So because I think earlier in the session, I think you have rightly pointed out that we're all heading there. We all become old. We all become disabled at some point. So it's not us and them. But as Dr. Sangha said, reasonable accommodation, universal design, twin track, not treating something separately, but really including and becoming truly inclusive. With that, I think I would now move on to the next more interesting part of this session as well, because it's really your interaction with the panelists that would be enlightening. So I would like to open the floor for discussion. I'm mindful of my time as well, so I want to open up the floor for discussion. Any questions left?